So much for joining us today. Dr. Kehinde ELISHA speaking here. We're now going to go through NGN test taking strategies for NCLEX 2025. So we have 99.9% pass rate. You got to put your work in. We also take students that finished many years ago. So we encourage you to put all that work in now and get through and get planted in a job before all this economic crisis that is going on right now. Hopefully, you're not affected in any way. Now, February 28th is today, 2025, and Dr. Kehinde ELISHA speaking here, founder of FNP Certification Academy. So we're now going to quickly focus on what are the types of questions that you're going to most likely encounter on the new generation NCLEX RN. Listen, knowing what you're going to encounter is more like a GPS. If you're trying to make a trip to somewhere and you don't have a GPS together, you're going to get so lost. So you don't want to walk into things like this and be like, oh my gosh, I didn't know that. So let's take a look at the types of questions that you're likely going to encounter. So we have the multiple choice response, which is going to be mostly SATA questions, multiple response to select N, multiple response, grouping, matrix multiple response. So we have multiple types of multiple responses. Does it make sense now? So, but then what is how do we handle these multiple response questions? You got to recognize the cues. You got to analyze the cues. You got to prioritize hypothesis, accept matrix multiple choice. You got to generate solutions, take action, and of course, evaluate outcomes. The next one is the drop down button. Now, we don't have the tools to kind of let you see this, but at least there is a little training that happens right before your test. You can go ahead and utilize that. As soon as you get to the exam, they give you like maybe 30 minutes or something like that to actually walk through the system, click through and the sample. And you can skip it if you think you know it. You don't have to go through that little training that they give you because they know that not everybody is computer savvy anyway. So we also have the drop down button. The drop down close, the drop down rationale, the drop down in the table may be replaced by a drag and drop table. So again, you have to follow the same strategy to get through your test. You must recognize the cues. You have to be able to analyze the cues. You have to prioritize hypotheses. You have to generate solutions and take action. You have to evaluate outcomes. Now, what about the drag and drop? We have the drag and drop close. We have the drag and drop rationale. Again, same thing. Prioritize hypothesis, generate solution, take action, and evaluate outcomes. And then highlight in the text, highlight in the table, recognize cues, evaluate outcomes. So now, matrix multiple choice case study. So let's take a look at this case study quickly. I'm not going to put you to it. I'm just kind of trying to expose you to what you're likely going to encounter. So we're not going to spend too much time on this. We're just going to flow through it easily. A 28-year-old client in labor who is receiving oxytocin infusion reports, my water broke and I feel like something is coming through my vagina. Now the nurse performs a vaginal assessment and finds that the umbilical cord is protruding from the vagina. For each nursing action, click in the box and indicate whether nursing action is indicated, appropriate, or necessary, or contraindicated and could be harmful. This is similar to what you're going to get on the exam. So what is the purpose of NGN exam? The purpose of NGN exam is also really to pull you into that world, into that real world, to give you idea on how to actually handle real clinical scenario. You know, not everybody have the best clinical experience. Not everybody lay hands on a patient. And this is kind of like doing that in some way, because you need a lot of critical thinking to actually get to this level. So what is your action as a nurse? Is this indicated? Do you want to administer oxygen to the client? Is it indicated or is not? Do you want to notify the obstetric healthcare provider? Is it indicated or not? Do you want to monitor fetal heart rate continuously? Is it indicated or not? Do you want to increase the flow rate of the oxytocin? Is it indicated or not? Do you want to gently push the cord into the vagina towards the cervix? Indicated or not? Do you want to go ahead and position the client with the head of bed at 30 degrees? Is it indicated or not? Do you want to wrap the cord in the sterile towel saturated with warm saline, normal saline? Is it indicated or not? Do you glove on the hand and of course insert two fingers into the vagina? Is it indicated or not? And then your answer will now follow. Of course, we know that the top three is very, very priority. And of course, this one right here is really contraindicated. And this last two is also priority. So you will know this only by what? By studying your content. There are no strategies without content. When you know your content, life is easier. So we're not going to go through rationale. I'm just kind of giving you an overview of what your case will look like and the strategy to approach them It's pretty much focusing on the data, right? You have to think about the purpose of what they are giving to you. You have to focus on the keyword. What is really this case about? What is it really about? You have to also look at what, you have to also think of, okay, is it an emergency situation? Is it just something that I can slide a little bit? You have to look and put all that picture together, okay? Now, we're now going to go into multiple response selector that apply. This we are really familiar with because for many years, NCLEX existed this way. So you are probably, familiar with multiple SATA questions anyways. So a 5-year-old child with a history of asthma is brought to the emergency department by the parents who tell the nurse that the child is having an asthma attack. So health history notes, diagnostic studies, laboratory results. So child is dyspneic and complaining of chest tightness, apprehensive and anxious, wheezing hard bilaterally, and so on and so forth. Now, as you're looking at this case, you're thinking, what exactly is the main keyword that I need to pay attention to? So listen, what exactly is your keyword? Your age, your sex, your situation, your setting. Those are your keywords, among other things. So if I have to pick out a keyword right here, a 5-year-old is a keyword. The diagnosis, asthma, is a keyword. The setting that we're going to be handling this patient is a keyword, right? That is the emergency department. Listen, speaking is Dr. Kehinde ELISHA, founder of FNP Certification Academy. Here we teach you how to pass your test. We teach you how to also practice in real life. www.npcertificationacademy.com. So now look, we now have some vital signs right here, right? That are kind of like well noted, and then you have to now say, okay, is this one on the low side? It's kind of low grade, it's like 90%. Temperature is kind of like low, it's kind of normal, 37. R rate is kind of on the high side, but not too bad. What is your normal R rate? Then you want to go with what you already know. That, okay, I know that my normal R rate is a 60 to 100. So if I get 112, I'm not too far from the norm. However, it is still on the high side, so you still have to pay attention to, okay, why is my heart rate going up? What could be causing this? And that's the way you think as a nurse, right? In that test, you got to put on that nursing uniform, remove the nursing assistant uniform, and drop that nursing uniform on because you are a nurse as you walk into that test. So respiratory rate, 20, 24, which is also not bad. Of course, we prefer like 12 to 20 for our respiratory rate, but 24 is not bad. It's kind of going up a little bit, and that tells us, okay, something is going on. And our blood pressure is definitely within the normal range. So what action should you take? And it gives you your SATA right here. It is not telling you to pick a certain number of questions. It's saying, okay, whatever applies to this case scenario, pick it. Does it make sense now? This is one beautiful thing about the NGN. You get a partial credit now. Let me say you pick these 4 answers, and this one is wrong. You're going to get partial credit. And I think that's a plus. In the past, you know how it used to be? You're going to go ahead and miss everything. It's kind of sad. That must have been brutal. So really, the NGN is something, it's a blessing. Just see it like that. Don't be so intimidated by the NGN. Now, let's go ahead and go to the next taking strategy. I'm more focused on strategy on this case. Not strategy, it's question types, Multiple grouping, okay? Multiple response grouping. So look at this. It says it evaluates outcome A, hospitalized 65-year-old patient recovering from post-operative unit following open reduction with internal fixation of the left hip, right? The nurse is performing the first assessment after having received what the client from PACU 15 minutes ago. For each body system below, of course, you're going to see some images, you're going to see some stuff that you will connect better with. Again, I don't have the 100% platform right here, but I have something close to what I can guide you with. So now they have the, respiratory system or the body system right here. They now have the assessment. What did I discover about those body systems? With respiratory, this is my discovery. With cardiac, this is my discovery. With neurological, this is my discovery. With the genitourinary, this is my discovery. Integumentary, this is my discovery. So that's what you discover, right? And then it gives you the assessment details and so on and so forth. And then it gives you test taking strategy tip. But again, you kind of see how this is what style? Multiple response grouping. In a way, it is in a group of body systems, and then you are now picking out, something that is off that you need to highlight. Does it make sense? So your knowledge is still the foundation of this. Do you know the normal respiratory rate? Do you know the normal oxygen saturation? Do you know the normal blood pressure? You see what I'm saying? That is what's going to help you to pick your answer. Okay? So that's the question type right there. And those are the 3 common ones that I know that I have. And, we can go through this question for real and just do it as a group. and see what we can, achieve from that. But I hope you kind of like pay attention to your test styles and you are practicing and mastering these test styles before you walk into the actual test. Speaking is Dr. Kehinde Elisha, founder of MP Certification Academy, Nursetonursecoach at gmail.com or info@npcertificationacademy.com. Thank you.